Corti can be used on patients of all ages and for many different applications. Regardless of age, the patient must remain as still and as quiet as possible to ensure an accurate result. It is important to test in a quiet room such as a small office or patient hospital room with the door closed. For newborn hearing screening, the OAE probe must be securely inserted into the baby's ear canal. Massage the front of the ear canal and pull down and out on the outer ear to pop open the ear canal. Select the appropriately sized ear tip and place it firmly on the probe. The red flanged ear tip will fit most newborn ears. However, you may need to select a different size based on the size of the infant's canal. If there is visible debris or fluid blocking the ear canal opening, it may be best to wait a few hours for the ears to dry out and then retry. Instructing small children about DPOAE screening is quite simple. You just need to pleasantly tell children that you will be checking out how their ears are working. The child doesn't need to listen for any sounds or tell you if they hear a sound. They just need to sit quietly for a short time. Typically, the small blue, yellow, or green ear tips accommodate most ear canals of children ages 3 to 7. For older children and adults, it's a good idea to tell them what to expect during the OAE test. You can inform them that you are going to check how their ears are working by presenting sounds to their ears with the probe. They just need to sit quietly for a few seconds while the test runs. They do not need to pay attention to the sounds or tell you that they heard it. For all patient ages, place the ear tip firmly on the probe. Once you have inserted the probe into the patient's ear, make sure that when you let go of the earlobe, the ear tip is still firmly in place and that it will not easily fall out. Do not hold the OAE probe during the measurement because this can introduce noise that may interfere with the testing.